Hello everyone. The video today is about possible causes of dyspnea, also known as difficulty breathing, associated with shortness of breath. Just before jumping into the video, if you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So somebody posted a question on one of my other videos saying, do you know common reasons why people develop dyspnea slash shortness of breath other than because of anxiety? So mine is 24/7 and it's been like this for months. So thank you for the question. Sorry to hear about the dyspnea. I hope that it resolves for you soon. So when it comes to dyspnea, of course, as mentioned in the question, anxiety is a possible underlying cause. Generally, if a person's, had dyspnea for a span of a few months, it's good to, so if a patient came in to see me and they had said I had dyspnea within the last few months, I would be thinking, well, what sort of things happened a few months previous to that, or what happened maybe in the several months leading up to that, few months ago. So, if, for example, a person had been having a lot, like say a person was a smoker, they were working in some environment where they were inhaling a lot of substances like fumes or chemicals that were toxic to their lungs or something like that. Of course, we have to rule out different breathing disorders like COPD and things like that, and those are things that are going to be influenced again by workplace exposures or day-to-day life exposures. But if there didn't seem to be something like that, like where there was some sort of like toxic exposure, like in more of a chemical sort of mediated type way, I'd also be wondering about whether that person had any history of mold exposure, because some folks will develop dyspnea because of related to mold exposure, whether they're in a moldy home, working in a moldy work environment or whatnot. So that's something that I would have on my differential diagnosis list for dyspnea. Also, some folks who are suffering with chronic infections. So folks who are suffering from babesiosis, like one of the co-infections of Lyme, that can be associated with air hunger, which some folks would kind of lump under the umbrella of dyspnea. It's not to say that other microbial infections, other systemic infections couldn't potentially manifest as dyspnea. So in some cases, folks might have dyspnea if they're suffering from long COVID. They might have dyspnea if they're dealing with other co-infections like maybe mycoplasma. Again, it would just really depend a lot on the history and depend what else was going on too. If it was just dyspnea by itself, it'd be a little strange for that to be a babesiosis thing or a mycoplasmosis thing. Whereas a person could have dyspnea, say, following just a bad upper respiratory tract infection, so bad cold, bad flu, maybe a post-COVID thing, and then some folks are just kind of left with this dyspnea. Oftentimes it'll be associated with a cough, not necessarily. So those would be other things to potentially consider. Beyond that, yeah, I mean, sometimes it could be something that's allergy related. So if a person was, say, moved to a new part of the country or to a different country or something like that, and there were different allergens in their environment, or it was potentially something seasonal. Some folks do, it's like they're 30 years old, they've never had allergies in their life, and then for whatever reason, 31, pollen season hits and like, oh, why am I getting all these symptoms? So folks can develop allergies. So there could be seasonal, environmental variables to consider. I had another one too, and then I forgot when I got into the allergies. Hopefully it'll come back to me before the video is done. Okay, maybe it won't come back to me before the video is. Oh, I remember what it is now. Sometimes food sensitivities. I've had patients where they have either gut issues related to SIBO, LIBO, yeast, or whatnot, and when we start getting their gut symptoms under control, like their gas, bloating, constipation, diarrhea, whatever it is, they're like, oh, I'm breathing more easily because we're getting their gut microbiome happier. Or in some cases, it can be related to food sensitivities. Oftentimes, that will be related more to classic mucus-forming foods like refined sugar, gluten, dairy, sometimes soy, sometimes corn. So those are sometimes foods that will have more of a mucus forming effect, and then that could potentially lead to some airway challenges. And then it could be other food sensitivities as well. So that's something I've seen as a more, like we'll say, atypical cause of dyspnea. So if a patient of mine came in with dyspnea and it seemed that they had a fairly clear history pointing us in one of these directions, then I'd pursue treatment in that regard. If it seemed to be just more like not really sure where it's coming from. It seemed to be just completely idiopathic. We have no idea, like no good insight into where it's coming from. Then I'd probably refer them to get some breathing testing done. And of course, if the dyspnea was quite notable, like especially if it was like, oh man, like I'm really having a hard time breathing, and I'm getting lightheaded from this, and like turning bluish, like just more extreme dyspnea, then I'd obviously recommend them getting checked out to see if there's something more nefarious or more pathological going on affecting their airways. But those are some of the causes of dyspnea that I've seen in my practice, where I mostly focus on complex chronic illness cases. That's on my differential diagnosis list. So thank you for the question. I've never had a question about dyspnea before, so I was a little bit excited to talk about it. I'm happy to talk about Lyme and mold and heavy metals and MCAS and all these things all day, but it's nice to just once in a while just kind of rhyme off some differential diagnoses for a given symptom like dyspnea. So I hope this information was useful. If anybody has any further questions about dyspnea, I can turn this into a dyspnea channel, just so I can keep saying dyspnea over and over again. But if any questions about this topic or anything else, just post it in the comment section below, and I will do my best to answer as soon as I can.